So I'm curious, how do you approach this in your work, in your healing work, in your therapy, what you mentioned about nature and what you do with art? How do you connect all of these worlds together?
Sure. So I've been an art therapist since 2005. And ever since I became an art therapist, I've worked with people who've had really overwhelming experiences. So in New York City, with homeless, mentally ill, chemically addicted adults, the folks on the street that for many people are quite invisible, right? I worked with women who survived sex trafficking and families who were in severe crisis and refugee children. So it was always really clear to me, these were complex problems. These were really complex systems and situations from which these human beings emerged. And what I was seeing in the present moment was the outcome of a really complex experience. So it was clear to me that there was no one size fits all, and that this really required an integrative process. So pretty early on, the way that I would approach clinical work was integrative. Art therapy, always the nucleus. It is the nucleus because I believe wholeheartedly that the creative process and our species' singular way of expressing our experience, expressing and sublimating what it is that we have experienced can actually heal the greatest ills of our time. So art therapy was always the nucleus. And then, these other kind of fields started to converge of trauma-informed psychology and somatics and mindfulness, right? And then when COVID came along and we were all here, I saw with folks, because I was continuing to work with people who had experienced what is known as complex trauma or acute trauma, right? Just overwhelming experiences, that they were even more dissociated. And, because all of those identity feeding, work, school, just moving about the world, they were gone.